Hi there, this is DeWitt Wilkerson, and I'm so excited to be part of the Practice Inspirations for the Seattle Study Club leadership team. Thank you for joining me today. I want to talk to you about something I'm very passionate about that I believe is the next frontier in dentistry, and I'm so excited to share it with you. It's about creating healthier patients and practices through what we're calling integrative dental medicine. A little bit about my background. I'm the founder and CEO of the Integrative Dental Medicine, or IDM Scholar Society, uh, centered here in St. Petersburg, Florida. I also have served for many years as the director of dental medicine and senior faculty at the Dawson Academy, right upstairs above the practice where I work with throughout my career since 1982 with Dr. Peter Dawson as my partner. I've served as visiting faculty for many years at the LD Pankey Institute and as an adjunct professor at the University of Florida College of Dentistry. I'm the past president of the American Equilibration Society, AES, as well as the American Academy for Oral Systemic Health. And most recently, I've authored a book about this topic we're going to be discussing today called The Shift, a dramatic movement toward health centered dentistry, the paradigm shift in dentistry, that we are no longer just looking at teeth and tooth carpenters, but that we are oral physicians and specialists of complete health. And so that's what I want to share with you very briefly today and introduce you to maybe a new concept. In 2012, I was introduced to the American Academy for Oral Systemic Health as they had a meeting at the Cleveland Clinic. And the Cleveland Clinic researchers and physicians there were the keynote speakers, including Dr. Michael Roizen, who you see here pictured with Dr. Oz, as he's one of the expert that is often on the Dr. Oz show. Dr. Roizen and many of the speakers there shared with us about the failing healthcare system and how we really don't have a healthcare system. We have a sick care system where you go in, get a diagnosis, get a prescription, and go home, not really looking at the whole person. And so the whole discussion of that weekend at the Cleveland Clinic in 2012 was about looking at the whole person. Dr. Roizen challenged us at the end of that meeting saying, I believe that dentists should be on the front lines fighting the health crisis that is destroying our nation. So as he described integrative medicine to us, as well as the other speakers and researchers, I realized that there was a field here we could call integrative dental medicine, whereby we in dentistry are on the front lines looking at the healthcare challenge, at the health crisis that we have, and taking an active role on the front lines of making a difference in intervention. And so, how does that work? As we've studied this now for 10 years and looked into what are the possibilities, what is the role of dentistry in complete health, we were able to narrow it down to really three pillars. And those three pillars would be local and systemic inflammation and infection, airway, breathing, and sleep disorders, and then TMD and occlusion. One of the key points that I learned in this research was this, that inflammation and infection, TMD and occlusion, airway and breathing are closely linked to each other. So often you'll see a patient who comes in with facial pain and morning headaches that has a breathing and sleep disorder such as sleep apnea. So these overlapping concerns are something that we quickly were able to identify as we were paying close attention to it. On this subject, I wrote a book entitled The Shift, in which we go through this subject in detail, the research, the science behind it, the possibilities that we have clinically. And in order to do that, we have to have systems. And so what we did was we actually developed a checklist, a very comprehensive yet simple checklist that covers this subject of integrative dental medicine. In the checklist, you'll see at the top that there are three columns that represent the three pillars: infection and inflammation, airway and breathing disorders, and TMD and occlusion disorders. From there, we go down each column vertically and we identify 6 or 8 simple history, signs, and symptoms that are red flags for a problem in any one of these categories. Then we list 4, 5, or 6 clinical evaluation signs that we can see when we evaluate the patient directly. And then we list 3 or 4 screening and testing tools that could be used to verify our suspicions. Once we've verified that one of these areas is a concern, we flip the page on the checklist and we have treatment modalities that we go through in a simplified manner that can be utilized to begin solving or addressing the problems that we've identified. So in this, we are able to not only begin to comprehensively look more thoroughly at the whole person, but we also can do the same evaluation no matter where we live. And so if we're in Seattle, Washington, or we're in St. Petersburg, Florida, we can do the same quality evaluation and decision-making model using the checklist, as well as developing multiple lines of business, which is obviously very important. So let me give you just a couple quick examples, starting with the low-hanging fruit. So if we look at the subject of inflammation and infection and think about integrative dental medicine in this topic, well, there's some great work that's been done, some great science that's been produced. Here's an example, Dr. Brad Bale and Amy Doneen, shown here with Dr. Pete Dawson back in 2019. They wrote an article published in 2016 in the Postgraduate Medical Journal about high-risk periodontal pathogens and how they contribute to the pathogenesis of atherosclerosis. They talk about 5 specific oral pathogens, oral bacteria that are commonly found, and how their presence can get into the bloodstream, get into the arterial walls, become part of arterial plaque, and actually are commonly identified in the blood clots of heart attack victims. And so they made a clear argument for the role of these high-risk pathogens as being contributory to atherosclerosis and as being risk factors, significant risk factors for heart attacks and strokes. So this now comes right into the arena of dentistry. In their book entitled Beat the Heart Attack Gene, Dr. Bale and Doneen use this illustration of a tree in which the fruit on the tree is atherosclerosis, or changing of the arterial walls. As you can see, the trunk of the tree is inflammation, systemic inflammation, which we now know is the number one factor for atherosclerosis and accelerated aging, is systemic inflammation. But we want to get down to root causes of inflammation, and some of those that are listed on the root of these roots of this tree are things like obstructive sleep apnea, which can create inflammation systemically and add to the risk of atherosclerosis. Also, you'll see root causes such as endodontic disease and periodontal disease, whereby these factors can add to the inflammatory cascade, as it's being described, that can add to atherosclerosis and accelerated aging. So we see that these dental topics become central to the subject of systemic inflammation and the inflammatory cascade, which is causing the health crisis that we're experiencing all across our nation. So there's a role for dentistry as we understand that these 5 high-risk pathogens, adding to the inflammatory cascade of the vascular system, where periodontal and periapical disease actually contribute significantly, we now know, to vascular disease. So we're all familiar with the surgeons now and hospitals requesting that a dentist verifies a patient's dental health before performing open heart surgery or maybe a hip replacement. How is that health confidently verified in our dental offices? Or periodontal disease treatment decisions should be guided by the eradication of specific elevated oral pathogens. How are those pathogen levels identified? The answer to both of those questions is salivary testing, which is now an invaluable tool for us for complete care practice of dentistry. So learning lessons that can immediately implement better patient health and increase practice revenue. I want to give you 3 objectives of salivary testing. One, I want to help you understand the guidelines for using it. Secondly, the guidelines for using it for treatment guidance. And thirdly, the practice revenue that can be produced as a result of these protocols. So when we think of salivary testing, there are excellent companies out there like Direct Diagnostics, and they do the HR5 high-risk pathogen testing, where we can look at these different bacteria and see when they're elevated. We can use salivary testing for periodontal disease and inflammation, diabetes, high blood pressure, cardiovascular disease, pregnancy complications, respiratory disease, systemic inflammation, pre-surgery for vascular organ cancer, joint replacement surgeries, and also when there may be a positive family history of any of the above. All of those are guidelines for the use of salivary testing, which is growing exponentially today across medicine, and certainly for us in dentistry, that would be a very easy thing to use. So the treatment for using this would be when we're looking at periodontal pathogens. You can use it for looking for HPV or COVID. And as we get results back, then we're able to make decisions whereby when we see a patient who has bleeding gums, we see a patient who has increased depths of probing, visual signs of inflammation. We do salivary testing and find that, yes, there are red flags. We can then implement specific periodontal protocols, which I want to share with you. The guidelines that come from the testing can help guide us into specific treatments, which can include subgingival scaling, the use of varnishes, periodontal gels and trays, the use of oral antimicrobials such as what's used, we use working with a company called Stella Life, which is a wonderful company doing biochemical research in the mouth to come up with wonderful products that can be used for rinses and gels, for surgery, for implants, for infections, for prevention of disease, for rapid healing, for the elimination of the need for using opioids in painful situations. We've partnered with Stella Life and had just tremendous results with them. Also, we're using oral probiotics and obviously electric toothbrushes and using different kinds of antimicrobial aids within even things like our water flosser. We're using systemic antibiotics, but with that, we use oral probiotics for gut health. And from this, we're seeing some tremendous results, such as in this pre-treatment and post-treatment case, using just the aids that are non-surgical in nature that we can use at home. For many years, I felt that using antibiotics systemically for periodontal disease was like using an elephant gun for a mouse. But indeed, this is no mouse. We now recognize the systemic risk factors that are associated with oral pathogens. And so we're really using an elephant gun for an elephant, along with these other adjunctive services that can be so valuable. But I want you to see that there's a practice revenue stream that comes from these very scientific periodontal protocols, non-surgical protocols, used in a very comprehensive and thorough way. If we had a case example of a 3 to 5 millimeter pockets with easy bleeding and early bone loss, doing salivary testing, getting the results back of elevated high-risk pathogens, following the protocols for eliminating those high-risk pathogens, using everything that we have in our regimen to do that, we have a stream of revenue, which for that one case would represent about $1,700 in production. If we were doing that once a week, that's $81,600 in production. If we were doing that once a day with one 3 to 5 millimeter pocket easy bleeding, positive salivary testing with early bone loss, that would be over $326,000 a year in revenue through doing scientific, non-surgical, clinically based, scientifically based, research-based therapies. And so we see great potential there, and we're treating not only oral disease, but the systemic effects of that oral disease, which is what integrative dental medicine is all about. Another one of the pillars I mentioned was airway and breathing. We know that's gotten a lot of attention in dentistry over the last few years, primarily though talking about making oral appliances for sleep apnea, but it goes so much beyond that. So doing home sleep tests such as the WatchPat 1 made by Itamar, which we charge $195 for an overnight study, since we've been screening our patients for daytime sleepiness and fatigue and for snoring and these different red flags that we can find that have to do with the potential for airway problems, a high Mallampati score where the uvula is not visible when we have the patient open their mouth, a neck circumference of greater than 16 inches, a scalloped tongue, tongue tie. These are the kinds of things that we can easily identify through dental medicine, whereby it would warrant the follow through of doing home sleep testing. So the WatchPat 1 is one that we use. We found that we can use that almost on a daily basis in our practice, in which we have three dentists in our practice. That generates about $780 of revenue each week, or about $37,000 a year, just doing home sleep testing. Other things that we look at, we in managing airway problems may use trial appliances for moving the mandible and the base of the tongue forward. MyTap is a wonderful trial airway appliance. We charge $400 for a MyTap. We're making at least one a week as a trial appliance, in which we're generating around $20,000 a year in our practice. But also, this often will lead into using more long-term oral appliances for sleep apnea, in which we're charging in the range of $3,000, making about two of those a month, where we're generating about $72,000 a year, just really not even trying to focus on this other than screening, testing, doing trial studies with trial appliances, and then, when appropriate, using full-time appliances. But also, this is leading into other things like expanding the oral airway, where we're looking for resolution protocols, not just management protocols like an oral appliance or a CPAP. And expanding the oral airway, we found that we're doing a lot more Invisalign, we're doing a lot more palatal expansion, we're doing a lot more ortho. In our group, we're doing more orthognathic surgery for the expansion of airway. Just taking an example of an Invisalign case, if we were doing two of those a month, there's $125,000 a month, a year roughly, in extra revenue, specifically for the purpose of trying to improve airway health and systemic health as a result of that through expanding the arches. Another resolution protocol would be releasing tongue tie. Dr. Suresh Zaghi out of Los Angeles and the Breathe Institute has been training dentists on how to do tongue tie releases, and many dentists are now doing that treatment in their practices using laser therapy and manual therapy. If a tongue tie release was about $950 in revenue, and you did one a month, that's another $11,400 a year. Many dentists are doing multiple tongue tie releases a month. And so another line of service, but a line of service through dental medicine that is actually improving systemic health, which is the emphasis of what we're talking about. I could go into quite a lot of detail with you on TMD and occlusion and how we are working with that problem as a specialty of dentistry that is also making a huge difference in systemic health. And so I hope you're able to get a feel for what we're talking about in using integrative methods in collaboration with our other medical colleagues to create healthier patients. But as I've tried to show you, also to create healthier practices. And so this is something that I'm very passionate about. I would love to speak with you more about this, or come to your study club and spend a day with you addressing this subject. My website is Integrative Dental Medicine at whitwilkersondmd.com. And we also have a teaching institute that we have launched in 2022 called the Integrative Dental Medicine Scholar Society. You can learn more about that at idmscholarsociety.com. If you would like to reach out to me personally, my personal email is whitwilkersondmd@gmail.com. And my cell number is 727-420-6860. If I could talk with you more about this and share my passion and the hope that this is something that you see as the next frontier in dentistry that can elevate our profession to a level that perhaps we've never dreamed and elevate us to a level of respect within the whole community of medicine, as well as in the patient population community, where our mantra today is, on a great day, we save a smile, and on an amazing day, we actually save a life. And so I hope that will be your experience in the future as it has been for me. And I look forward to talking to you soon. Thank you so much for listening today.